Alderneys Key FM.
Good morning, William.
Good morning, Dougal.
How are you, firstly?
Well, as Boris Johnson said yesterday, I'm raring to go.
Good. So, I shall let you make a start then.
Okay, well, let's start with the usual update of the position in Guernsey. So there have now been 247 cases of COVID-19 in Guernsey, still none in Alderney or Sark. So that's two more than there were on Friday last week. So I think we can, fingers crossed, see a trend now, which is the slowing down of the identification of the cases. But because there is a time lag in terms of where we are now and also the impact that the virus has had on people in the last couple of weeks. So, sadly, there have now been 13 deaths, and the number of deaths which are thought to be COVID-19 related is still 4. 171 people have now recovered from the virus, and that's an increase from 139 on Friday. So although, sadly, people are losing their lives, if we look at the position now in terms of positive cases, then the trend would seem to suggest that that is now being controlled by the strategy that has put in place by Dr. Brink. So again, every day really is just a confirmation that Dr. Brink's strategy is one that's working and is one which has been replicated across the world, and those are the jurisdictions where the greatest success has been achieved. So if you watched the television at all this weekend, there's been a lot of speculation in the media in the UK about the actual number of deaths, given that the number published each day is actually only the number of deaths in hospital. Now, this is relevant in the UK because really for the first time this weekend, there seemed to be a recognition that in addition to the people who were dying in hospital in the UK, there were also a substantial number of people who were dying either in care homes, residential homes, or within the community. Now, the estimates of that would bring the total number of deaths in the UK to round about 40,000, which is almost double the number which is given on a daily basis. Now, there are explanations as to why that is, and it's really all around how difficult it is to correlate the information about people who lose their lives in the community. But it is important because every life lost is a tragedy to every family, and so if we are to get a real scale of this in the UK, then those two figures should be put together. So if we look at that in terms of how does it apply in the bailiwick, well, the equivalent number of deaths in hospital we have is 2. So the Public Health Service in Guernsey has produced an analysis of deaths registered in Guernsey. This provides us with the data which would indicate whether or there are many more deaths than you might expect at this time of year. So the number of deaths for the week ending the 18th of April exceeded the average number of deaths for the same period over the last 10 years, but when the COVID-19 deaths were excluded from the figures, there was no excess mortality for the period. In other words, we can have some confidence that the number of deaths being identified and published by the State of Guernsey reflects the real number of deaths from the disease. This is unlike the UK, where deaths in residential and care homes and deaths in the community are not included in the published figures. Now, you can argue that this is a much simpler exercise because of the size of our jurisdiction. But the fact that we can do that and the fact that Dr. Brink and her team can produce that reliable information to us demonstrates that this is the information which is all the information we need. So we're extremely fortunate to be in that position so that there is no sense of things happening in the community which we're not aware of. So data is now being published about active cases. This is the number of cases other than those who have recovered or died. There are currently 62 active cases, whereas 2 weeks ago there were more than 160. So this is another sign that strategy to contain the virus by testing, contact tracing, quarantine and social distancing is working well. And again, if you caught any of the news over the weekend, you will see that there is a very strong body of opinion now in the UK that this approach will be the approach which will allow the UK to get control of the virus. So they will be, although it was on a massive scale, but nevertheless the same principles apply. So again, and I don't apologise for reiterating this, we are really lucky to have Dr. Brink and her team who are doing everything right to protect us. Now, again, I've referred to it before. It was mentioned by Gavin St. Pierre, but this week the States of Deliberation will be debating a policy letter submitted by the Policy and Resources Committee. The letter proposes that £100 million held in the Core Investment Reserve, which is called the Rainy Day Fund, should be used to fund the support measures for business which have already been announced. It goes on to recommend that Policy and Resources is authorised to borrow up to £500 million to deal with the unprecedented economic shock which the pandemic has brought. So just to be clear, this is not Policy and Resources asking to borrow £500 million now. What they are asking for is the authority to borrow up to that amount over a period of time so that they don't have to keep coming back every time they want to extend the borrowing requirement to seek permission of the politicians. So that money will be used to pay for financial support for businesses, the reduction in state revenues, the financing of Irini, and the financial challenges of other trading assets. So what it is really at this stage is a ballpark figure, because with the best will in the world, it is impossible to be able at this stage to make a proper assessment of what will be the economic cost to the bailiwick any more than those sort of calculations, despite all the professional advice that is available, can make it any clearer in the UK. So really what the Policy and Resources are saying is, yes, it will cost a lot of money, but they've put that figure out there, and obviously they will now start to do the detailed work as the circumstances become clearer and we get a better idea of what the new normal will look like, and then they will be in a position to respond to that. And of course, those considerations apply equally to us. You know, let nobody be under any illusion that we have and will also suffer economic hardship as a result of this pandemic. And again, it is really important that we make the right decisions based on the right information at the right time with the end in sight. So there's a massive amount of work that is going on, and that is also being undertaken at the same time as managing the health risk. So there are very complicated and difficult decisions which will have to be made. But again, I think that we can be confident that those decisions will be made on the best available evidence which the politicians can consider, subject to all the scientific advice that they've been given. So, well, how is this going to be paid for? Well, although the States of Guernsey has a sizable investment portfolio, which means basically these are assets which the states have, which could be realised, but I think it's fairly obvious that now would not be a good time to sell them, because the markets will be very flat and the amount that they would be able to get for the sale of those assets would not really reflect their true value. So rather than do that, it is proposed to raise this sum of money by borrowing. Now, this will put a significant debt burden for the bailiwick, and that includes us as well. So the Alderney and Guernsey taxpayers will are going to be impacted by this. So the purpose of this borrowing is to cover the cost of support measures that have already been announced, as well as allowing the States of Guernsey to continue to function and provide public services through these difficult times. And beyond this, there will need to be a recovery plan which may need to drive further investment as a stimulus to the economy and help us all get back to some kind of normality. So the commitment is there, the commitment to continue to support our vital services throughout the bailiwick, but also, when the time is right, put in place the structures that will be required with the appropriate financing to make sure that the economies in all the islands of the bailiwick can kickstart and can move forward with a view to getting back to, as everybody keeps saying, what will be the new normal. So these are quite extraordinary times, not only in the way that COVID-19 has impacted on our lives, but also in the way it is affecting the economy and public finances. So the States of Deliberation this week will get the opportunity to decide whether it is prepared to back the approach being proposed by policy and resources. So there'll be a forensic examination of that case and a decision will be made. So again, openness and transparency so that we will all know what the arguments are and we can all decide what we think is the appropriate way forward. Now, I'm conscious that the way the government is working is very different to what normally happens, and we've all had to get used to a very different way of doing things. And having read the journal, having read the press this weekend and one or two other things, I think it would be helpful if I invited James Dent, who is our representative on the Civil Contingencies Authority, to come onto the radio tomorrow and explain how the Civil Contingencies Authority works and what he is doing as a member of that authority to ensure that Alderney's voice is heard. So you will, if you like, get an inside track on how it works and how he brings the island's case into that forum. So he will be replacing me tomorrow, and then I'll talk to Dougal later on about how that impacts on what I'm going to be doing this week. Okay, so now moving on to my little checklist of things that I just need to draw your attention to. Interestingly, I saw a piece on the television yesterday about the vulnerable members of communities in the UK, and they used by way of example East Sussex, which has a high percentage of people over the age of 65, and it's interesting when you compare the figures here. We have 37% of our population are seniors, whereas in East Sussex they are already looking and concluding that in 10 years it may be up to 1/3. So they're projecting those figures and saying, well, even in 10 years it will only be 33%. So I only mention it because it does make the case that we have had to be so vigilant, because not only are we all at risk, but we have 37% of our population who are at greater risk. So it's important. Now, what flowed on from that was that, and they were interviewing a number of people, and they were all talking about how they were dealing with it. And it's very clear that people in that category are suffering a sense of isolation, a sense of loneliness amongst some, and interestingly, on the mainland, the number of calls to Age Concern has increased by 88% in the last 2 weeks. And the issues identified were those that I've just spoken of. So it would be unrealistic to think that even with the closeness of our community, that there will be people living on their own who are feeling now a sense of isolation, a sense of loneliness. And as I've mentioned before, this generation always put on the best face, but sometimes you just have to say, I just need some help. So what I want to say this morning is, please don't suffer in silence at home. Don't think that this is something you have to do on your own. It isn't. This is something we do as a community. And if you just want to chat, if you just want to hear a friendly voice, if you just want to have somebody at the other end of the phone just listen to how hard you are finding that and being a shoulder and an ear to listen to you, get in touch with Alderney Spirit, because we've got a lot of people who would be very happy to talk to you. So I've made this request before, but as time goes on, it is going to be a little bit more difficult. Therefore, we have to monitor it, and I have to keep saying to our respected and highly prized community members, please, just make that phone call. And the number you can ring is 820003. 820003. Now, the other alternative is I have set up a premium chat line, which is £2 a minute to chat to the President. So that's also a helpful opportunity to contact me direct. But I am only joking, of course. You know, I'm always here. Gabrielle's always here. Anybody who wants to chat, you know, you've only got to ring. So please don't take me seriously when I'm talking about a premium chat line. Next thing, interestingly, I got a message from BBC Radio Jersey at the end of last week asking if I would do an interview on Saturday morning at 8:30, which I said I would. And then I got an email on Friday night saying it had been changed to 7 o'clock. So I'd obviously been bumped down the list a bit. And basically what it was, they were going around a number of different islands, the Channel Islands, the Isle of Man, and just asking basically how people were dealing with and how the islands were dealing with the impact of these challenges. So I did the interview, and what was interesting was that I got the very clear message that what they really wanted to talk about was our media strategy, because he suggested that people in Jersey were not happy with the way in which the government was getting information out there by way of just 2 press conferences a week. And what he wanted me, I think, really to say was that we were doing it much better than they were. Well, being modest as you know I am, I didn't think that was an appropriate thing to say. But what I did say was how we had identified how important it was to have this local voice on the radio every morning, somebody that everybody knows, hopefully somebody that everybody trusts, who can explain things in a way that makes them accessible to the community and also gives them the most up-to-date information. So I think, once again, it's a validation of Dougal, Key FM, and the way in which we have gone about this. So leading from the front once again. Now, I heard this morning, and I'll just mention it now, that the farm shop are no longer delivering. Jean's stores will now be open. The times, I think, are readily available. So you won't be able, unless you are in self-isolation, to have your shopping delivered. But what Hannah suggested was that anybody who was struggling might be able to get a friend or a relative to do their shopping for them. So all I'm simply saying is that the Alderney spirit is there to help. We have volunteers who, for people who, for whatever reason, cannot do their shopping themselves, will be able to help with that. So again, please ring. It's the same telephone number, and we can support you through that. What's next? Oh, yeah, there was a really interesting program on Channel 4 last night called When Will Lockdown End? That was presented by a Dr. Van Tulliken, and he interviewed people who were subject to these restrictions, people in their homes, and he also spoke to a lot of medical evidence, a lot of scientists, and I thought it was a really helpful explanation of where the UK are, because of course that will also have implications for us. So that was called When Will Lockdown End? And for anybody who has access to Channel 4 rerunning it, I think it really is something worth looking at. What else have I got to tell you? Barbara Benfield, who is assisting in the celebrations that we're putting together for VE Day, has suggested that maybe as an island-wide effort, although we can't all get together in the Island Hall, which is a massive disappointment, nevertheless, Barbara's suggesting that perhaps shops could decorate their windows to celebrate VE Day, and also we could all perhaps do something in our own homes, just to mark the event and to connect us all with what is a very important landmark date that we mustn't forget about, and we must mark it because it's part of our joint history, and it also demonstrates how resilient people are. And even though the Second World War took a terrible toll, nevertheless, people rolled their sleeves up, got stuck in, and built the world in which we now live. So we have that similar responsibility, and we're doing it now. We're rolling our sleeves up, we're doing what's necessary, and we will continue to do so. So I think, Dougal, that is probably... just one final reminder. The Helping Hand appeal, if anybody is struggling and wants a helping hand, can I just remind you that you can contact Jill Trousdale, who is my secretary, on 82001, 82001, from 9 a.m. till 12:30, Monday to Friday, or email president.alderney@gov.gg. president.alderney@gov.gg. And again, please don't suffer if you're struggling. This isn't about having to ask for charity. This is about asking your community to help you and support you through what are, for all of us, challenging times, but some of us find it more difficult than others. So we've set that up. It is there. Please, if you are struggling, take advantage of it. So I think on that note, Dougal, I shall say thank you very much.
And thank you very much, William. And hopefully we're going to speak to you again very soon. But for now, and did you you got a mention of snake hips too this morning?
Well, do you know what? I've got to be honest, Doug. I am disappointed. I was hoping for 1,500 over the weekend, but I think I've plateaued. I think I'm finished.
Well, let's not push our luck.
Can I just for the sake of completeness? So James Dent will be on tomorrow morning, and then I'll come on Wednesday.
Okay, so I'll sort that out for 9:15 tomorrow.
Yeah, and I'll do Wednesday and Friday this week.
Lovely.
But obviously, if anything else comes up, I shall be there.
Okay then, William.
Okie dokie.
Thank you very much indeed.
My pleasure.
Okay.
Stay safe.
Yeah, and you stay safe too. Bye for now.
Bye.
Bye.
Alderneys Key FM.